Good afternoon, everyone. Thank you for joining today's webinar, Adapting Public Space in Response to Physical Distancing Requirements, Embracing the Temporary as the New Normal, hosted by the Broward Metropolitan Planning Organization. This webinar is part of the Broward MPO Complete Streets Initiative, education and training program. Better Streets, Better Broward, Better Life. My name is Stephanie Garcia, Complete Streets Manager in the Broward MPO, and I will follow up with your questions after the webinar. Now, I'm going to turn it over to Greg Stewart, the Broward MPO Executive Director, for the official welcome.
Good afternoon, everybody. Thank you, Stephanie, and good afternoon, everybody. Welcome to our Complete Streets seminar regarding new ways of dealing with public space since the COVID-19 crisis started. One of the things that we've really been striving for at the Broward MPO with our 33 member governments is to provide information that will help our governments better handle the journey ahead. And while COVID-19 may not have been one of the best things to occur in our lifetime, it has been one of the greatest learning experiences of mine. As we kind of reopen our communities and rebuild, understanding what our roadway network looks like, our street and sidewalks should be, and how all of this actually builds a better Broward by better roads and better streets, this is part of what we look at as kind of dealing with technical urbanism. And today you're going to have three great examples from member governments within both Broward and outside of our region that actually took this challenge and tried to understand what the impact of the COVID-19 epidemic actually had to do on public life. And as we move forward, the Broward MPO is very proud to have the city services team along with our Complete Streets team to work with each individual city government and our county government as well as the school board to help build a better Broward as we move forward. And with that, I'm going to turn this over to Fabian. And Fabian, it's all yours.
Thank you, Greg. So hello, everyone. It's exciting to see that there's over 150 people connected, so welcome. For those who don't know me, my name is Fabian de la Espriella. I am a senior planner with Kittleson and Associates, and I will be your moderator today. We're part of the Broward MPO's team supporting community engagement efforts for their Complete Streets Initiatives program. So we've been coordinating these for over a month, and we hope you find value in everything that's going to be shared by our amazing panel, who we thank for accepting our invitation to participate in this event. But before we officially get started, let's cover a few quick housekeeping items. You're all muted, but if you have questions, no worries. We will be monitoring the question chat box throughout the discussion, so feel free to jot down any questions you may have as we go through each of the presentations, which we will then have a 10-minute Q&A session at the end, and our plan is to pull from those questions that you will be logging in throughout. In relation to polls, we will be throwing some quick polls along the way, so be in the lookout so we can capture your opinion as we go. Also, just as an FYI to everyone, this webinar is being recorded and will be posted on the Broward MPO's website in the coming days, so stay tuned. In terms of overview, today's webinar consists of the following. We'll wrap up introductions, and we'll do then a quick overview on the topic to give some context. And we'll then hear from our panel, where we'll learn from the City of Tampa, City of Charlotte, and City of Fort Lauderdale strategies. We'll then jump into a Q&A session, and we'll then wrap up. So let's move on with panel introductions. During this webinar, you'll hear from leaders who are working in their communities to make sure people have space to physically distance and have access to open space during these challenging times. So I'll start off by introducing Danny Jorgensen. She is the Chief Transportation Planning Engineer at the City of Tampa. She has over a decade of experience working with communities throughout Florida to plan, prioritize, and implement complete street projects. We also have Taiwo Jayauba, is the City of Charlotte's Assistant City Manager and Director of Planning, Design, and Development. And with nearly 30 years of regional, municipal, and private sector experience, Taiwo has extensive experience leading planning and transportation initiatives nationally and internationally. Before joining the City of Charlotte, he served as Director of the Sacramento Regional Transit District in California, and he was also Director of the Planning and Development in Grand Rapids, Michigan. Our last piece of the puzzle comes to us as a team to share the City of Fort Lauderdale's experience. We have Karen Warfel, who has been with the City of Fort Lauderdale since 2013, most recently as a transportation planning manager, program manager. She has 23 years of planning experience focused on transportation, smart growth, open space, land use, complete streets implementation, and redevelopment. Christine Thompson is one of the program managers for the Transportation and Mobility Department for the City of Fort Lauderdale. She really oversees maintenance of traffic or temporary traffic control effort and special projects. And last but not least, we also have with us Mark Plass, who has been with the Florida Department of Transportation for 30 years as a traffic operations engineer for District 4. His focus is on safety and transportation system management and operations, TSM&O. So we wanted to report back on what we heard from all of you during the registration survey. And we're glad to say that we have representatives from 20 out of 31 municipalities in Broward County. We also have participants from Miami-Dade, Palm Beach County, FDOT, AARP, Broward County Transit, and SFRTA. So let's quickly cover some of the highlights of what we heard in terms of the survey. We first wanted to kind of learn from all of you in terms of the mobility and livability challenges that you guys have been experiencing. And we heard these themes: transportation, public space, the digital switch, connectivity and safety, city services, data, and quality of life. Things we heard ranged from, not all modes being served, maintaining transit schedules and having buses clean and safe. Of course, access to public space, parks, and outdoor seating was an issue during the shelter-in-place orders. We've seen that also City Hall has been closed to the public, and there's also been physical and social isolation, which has also dealt with mental health issues and job loss. And so, there's within these themes, there's a range of things that we were told by all of you guys. Second, we also asked about actions implemented as part of the COVID-19 response. And in terms of the things that we heard, we know that there's fare free transit, there's reduced route frequency due to reduced ridership, there's been closed parks and trails, but there's also been signage and there's been public art with physical distancing messaging. There's also been the use of right-of-way for expanded outdoor seating areas. There's also been, in terms of the digital switch, there's been workshops done for businesses based on financial assistance programs. Overall, in city services, there's been a range of things that have shifted definitely to the virtual world. And in terms of quality of life, we also heard that there's inconsistency in the application of physical distancing recommendations, which continues to be a challenge to all of us. But overall, we also wanted to gauge the level of interest or support to explore or implement temporary COVID-19 response measures. And we got a high number of responses saying communities are supportive on implementing measures, but we also got a high number of no response to these questions, which is why it's even more important for all of you to participate in the quick polls that we've sprinkled through the webinar to kind of get a sense of how you feel about these measures. So with that, let's get started with a quick topic overview and context to frame why are we talking about these today. So it's been almost impossible to keep up with everything that's been changing around us in the last 4 months. Communities and people around the world are adapting to the unique circumstances brought on by the pandemic. It's been a time for cities to experiment using their streets as testing grounds for change. And we've seen on the news all from Portland, Seattle, London, Oakland, and of course, Tampa, Fort Lauderdale, Charlotte. Everybody has been experimenting and using different strategies, which we've been learning a lot from. So this new reality has challenged cities to think about how they can expand bike and pedestrian networks to meet the increased demand for people to practice physical distancing while remaining active and making trips to essential goods and services. And some of the challenges related to the public realm that most cities are experiencing have to do with sidewalks being too small to maintain physical distancing, increase of vehicular speeds, the safe and accessible bicycle and public transit routes, and access to public spaces. And there's a lot of resources and maps that are tracking the COVID-19 livable streets local responses across the country and across the world. And we've seen that tactical urbanism has really been the popular choice for cities to install temporary measures to increase space for people. And so for those of you who are not familiar, tactical urbanism really refers to a methodology, to a class of inexpensive temporary projects designed to demonstrate the transformative power of interventions in the public space. And so tactical urbanism is not about achieving perfection. It's more about aiming of delivering a proof of concept where we can leverage short-term action to long-term change. And there's a lot of literature on this that you can check out as well. So why tactical urbanism now? Well, because projects can be delivered quickly. And so tactical urbanism is quick build projects, and they have a project delivery tiers, if we want to call it that way. And we can deliver projects as a demonstration or as a pilot project or as an interim design before we get to delivering a long-term capital project, which uses a lot of time and resources from municipalities. So tactical urbanism is really a way to explore those opportunities where we really want to test some ideas. Each project scale has a different level of investment, of course, and what we've seen in the last few months fall under demonstrations for the most part. And there's been a variety of livable streets responses or response strategies across the board. And we wanted just to mention a few of these framing our discussion today. They've been converting vehicle lanes to pop-up bike lanes. They've been creating sidewalk extensions for business and retail purposes. They've created transit lanes. There's been full and partial openings of streets to pedestrians, like slow streets and shared streets. There's been pickup and delivery zones established, outdoor dining, also called streeteries. There's also been adoption of temporary parklet programs, and also traffic signal or operational changes, for example, eliminating the push button as strategies to help with how we navigate our cities in these times. And also signage and physical distancing markings have been very popular as a very minimal strategy, but nevertheless effective. So that's all from me now, and I'll pass it along to Danny so she can tell us all about what they've been doing in the city of Tampa. So with that, Danny, you have control of the screen right now.
Thank you very much. Hello, everyone. I'm very excited to be presenting today on the City of Tampa's Lift Up Local Economic Recovery Plan. This was a plan that we very quickly assembled over the course of a weekend in response to the governor's initial phased reopening of the city. And so when we initially thought about what would 25% look like for our businesses, we felt like they needed more space. And so we looked to the city right of way, as well as their own privately owned parking lots to allow them to do that. So the way that we were able to do that is that we worked with our mayor, Mayor Jane Castor, to do an executive order. And that executive order temporarily removed the requirement to do permitting or any other kind of requirements for our sidewalk cafe program. This idea really originated with our economic development and opportunity. And so, as I said before, it was a way to increase the footprint of the businesses. And a lot of credit really goes to our Tampa Mayor, Jane Castor. She's bold and she views our city as a lab. So sometimes cities can be conservative and risk adverse, but we felt like we just needed to jump right in. So with this program, any permitting fees or applications were temporarily suspended. And we created a website and this guidebook, which you can see pictured here, and it's still on our city website, but it has a lot of really great information. We initially contemplated that a pilot program would be 14 days, but that was in the beginning of May, and this program is still active. So it's been going on about 2 months. While some of the full street closures we had originally planned have been removed, there's still one full street closure as well as several restaurants using the sidewalks and parking spaces for an expansion of their footprint. There we go. I would say that city collaboration was key, both internal and external. I mentioned that this program from concept to conception was just a few days, so we didn't have time for traditional engagement, but we did very much work with our internal city partners to make sure this happened. Our city legal team was critical. They reviewed our legal code, our municipal code to review, to help us craft that mayoral executive order, which removed the requirements for permitting. We also established an informational hotline. So you'll see the phone number on the bottom, but that was very beneficial to us because it helped us to understand questions and comments and concerns from businesses. And then we were able to be very nimble and tailor the program as it progressed to what the businesses were asking and saying that they needed. Also, our mayor led daily briefings, which included our police chief, our fire marshal, and administrators and directors. So everyone was getting information about this program on a daily basis. Prior to the first day of this program, which was in the beginning of May, we did a series of webinars for some of our local businesses and restaurants. We presented the information from the guidebook, and based on the questions that they asked on that webinar, we were able to tailor the guidebook and some frequently asked questions to them. We also worked with them on a continual basis, and we modified street closure locations. We also learned from them that one of their biggest concerns was making sure that pickup and delivery services were able to easily access restaurants. And so we created branded signing, and we created special pickup and delivery zones for them. So those continuous conversations were paramount to the success of this program. And as I mentioned, we also have that comprehensive website with branded printable information. And you'll see here on the right, this is an example of a sticker that one of the restaurants locally proudly put up saying that they have met the requirements of the city's program. And so that was a great marketing tool for them to use to encourage patrons to come back. So we had 3 typologies for activations, one of which was sidewalk. So traditionally, the city of Tampa would have required a sidewalk cafe permit to be obtained, but we temporarily waived that requirement. We limited it to the adjacent frontage in front of the business. They had to talk to their landlord or property owner. We did still expect that ADA and other access standards would be applied. We worked with our ADA coordinator, the fire marshal, and the police to make sure that they still had proper access. And then we also expected that 6-foot separation would be required. And you'll see in a bit that we did a diagram showing an example setup. We also allowed parklets, both use of on-street city-owned spaces as well as privately owned parking lots. Similar requirements to the sidewalk. We did not require ADA ramps for access to the parklets, but moving forward, if parklets are to remain, we would expect either a flush parklet or a ramp to be configured. This is the example I mentioned about configuration we drew to show what an example sidewalk cafe or parklet could look like. We wanted to highlight some kind of temporary barrier materials between the parking spaces and any travel through lanes for safety. And then our cafe and retail zones were our full street closures that we implemented. And those are locations that the city proactively planned. This was not a reactive portion of our program. We selected locations based on clusters of economic activity, based on parallel connectivity, based on safety considerations. And we did include in the guidebook some modified business hours. They were allowed to sell alcohol in the street closure areas. And we did have police stationed at the entrance to each full street closure. We really wanted to, we didn't want a party atmosphere. We wanted people to go sit, eat, and then leave. So no seat, no service. If you weren't dining at a restaurant, this wasn't a place to just walk around. And then some general requirements we had for our outdoor space. The governor's executive order obviously applied. In the beginning of the program, face coverings were required for any staff working. At that time, they were not required for patrons, but now the city has issued an executive order requiring any City of Tampa businesses to require patrons to use face masks when not eating. We required that reservations for restaurants be used to kind of avoid people loitering or waiting. Again, we used our sidewalk cafe permit restrictions as guidance, but no permits were required. And because of the time frame of this, we did not require any kind of additional business liability insurance. And then if a business chose to use tents or any kind of temporary structures, we also issued guidelines describing those. Throughout the program, we tried to issue branded materials to best support businesses opening. So for example, on the left, you'll see a table tent that says this bar is closed. And then on the right, you'll see the responsible patron checklist, and both are available on our website. But we wanted to allow businesses to be in the business of hospitality and not enforcement. So we tried to put that as much as possible back onto the city. We also tried to encourage social distancing. So you'll see on the right, we used some spray chalk with a stencil to indicate 6 feet distancing. We also used our in-house operations team to create the signs you see on the left. And then soon we'll be going out and doing some similar activities to show that we're trying to encourage people to wear masks. And then during one of our full street closures, we did take advantage of doing an intersection mural. So you'll see Tampa Mayor Jane Castor on the left painting part of the mural, and it just turned out beautifully. And it reflects our Lift Up Local branding, as well as it's just an uplifting feel to look at it. And it is a good nod to the city of Tampa's history and some of our architecture around there. So the key takeaways, this project was a success. We talked to a lot of restaurants who were near 100% pre-pandemic revenues and occupancy because of the expansions. Restaurant participation did increase over time. Anecdotally, the overall compliance was good. We did find that restaurants which operate more like a bar than a restaurant tended to maybe have some more people than they should, or they allowed people at a bar, but we worked with them on an individual basis. And then I would say that the internal coordination was key, working with our internal city stakeholders, as well as some external city stakeholders, like our downtown partnership, our chambers of commerce. They really helped us to communicate the messaging, talk to businesses, and bring that information back to us. And I would say that this pilot program showed the city that open streets programs are very beneficial, not just from a business perspective, but from a Vision Zero, and a lot of opportunities there. So we're very excited about the future of open streets and how this program can pave the way that we change our outlook. With that, I'll turn it over to Fabian.
Thank you, Danny. So with that, it's the first quick poll, and I will be launching it right now. So it's related to what Danny just talked about, and we just want to gauge which kinds of business-friendly measures will be supported in your community. So we're collecting responses and we're monitoring here. It shouldn't take long. Awesome. We're almost halfway of you guys voting. All right, we'll give a few more seconds and we'll move on. We're almost 70% there. Very interesting. And once I close the poll, I will be able to share, and you'll see the results of the quick poll on your screen immediately. So come on, come on, come on. We're almost 80% there, so. All right, so with that, I'll close it and we'll share the results. So we can see that using the public right-of-way, sidewalk and parking lanes seem to be the most preferred, but they all really got a high voting, so that's great. So we'll move on. And with that, I will give control to Taiwo, who will start here. All right, Taiwo, it's all you.
Thank you. You all hear me?
Yes.
All right, thank you very much. Good afternoon, everyone. So I will just, advance the screen here. Well, you might need to help me advance it.
Okay. Yeah. All right, get started. Yeah.
So we pretty much experimented with three things in terms of activity in our urban realm, and I will go through each one of those with you. One is our shared streets program, which in some places have been referred to as healthy streets or slow streets. And then Charlotte is open for business, which is our outdoor dining program and our street retreats. And then I will share with you what we've been doing with our street mural. So starting with a shared street, essentially, there's a number of things that Danny shared that are similar to what we've found and what we started to do. Even though we've been having these thoughts in mind for some time of how we dedicate the majority of our right-of-way in our street to pedestrians and bicycle users and folks on wheelchairs, we'd really not been able to roll this out. So pandemic, as tragic as it is, gave us that opening to be able to respond to the shared streets. So again, like Danny shared, on the next slide, you'll see some of the similarities there. We started to, obviously, it was a collaboration, but it did not start that early as a collaboration, frankly. As the governor of our state started to reopen the state, we moved into the first phase, which really allowed us to be able to implement this. But our public health officials were concerned that we were going to create opportunities for people to have block parties and not be able to respect physical distancing. And so we wanted to make sure that we sat down with them, explained what Share Street was about, and then decided to go on a phased rollout. As a matter of fact, this Saturday will be the second phase of the rollout, and we have the rollout in a couple of phases. And so we keep saying that through traffic is not allowed, but it's open to emergency vehicles, but definitely we've seen a lot of support for it as well. In the next slide, you'll see what we've done with regards to our signage. We posted these signs on every street that we are sharing, so people know how to respect the physical distancing, how to make sure that no matter what they're doing, whether they're walking or they're jogging, they keep some distance. Even with their pets, they should try and maintain distance between them and others while they're walking their pets. So we tried as much as possible to post these where they're visible, where they would not be intrusive in terms of vehicles for residents who still live in the community. To date, the feedback has been great. About 113 total emails, actually 114 emails total. On that next slide, you'll see how that's divvied up. Pretty much we had over 60% of the people that support, and pretty much even nominated some streets where we can do this. For the folks who were against it, they were not necessarily against the concept. It was really more of the inconvenience for them, because they would use that street to drive through to get somewhere before. So it was not necessarily against the concept as much as it was, you know, why are you doing that to my street, so to speak. And so we continue to do this evaluation on a rolling basis. As we roll streets out, we evaluate, and we continue to do that as we go forward. So far, just like Danny said, it's been a tremendous success, so much so that we are moving into the second phase this weekend, and then we will test that again, see what the feedback we're receiving, and then move on to the next phase. So let me share with you our outdoor dining street trees program. We wanted to also make sure, even though this was also a conversation we've been having, but in association with our transit stations, we felt this was an opportunity for us to expand that conversation. And we went ahead and launched the program. The Charlotte is open for business. Not that we were closed necessarily, but to pretty much say that our streets and other places like sidewalks or parking spaces or street parking lots could now be converted as an extension of sidewalks into places where people could utilize for eating. And we pretty much said we were going to do this for a 90-day period and allow a number of restaurants to apply for permits during that period. And we're going to waive the fees for them to be able to do that. And so we've seen tremendous support for this one, perhaps even more so than the shared streets, because during the first phase of lockdown, obviously nobody was going out to eat out and all of that. So our restaurants were really impacted, like in every other city, with regards to their businesses. And so this really provided that opportunity for people to come out and really be able to experience life with other people eating out. The next slide, again, similar to what Danny shared with you, we made sure that we had the guidelines there respecting the physical distancing requirement. In our case, we were permitting no more than 50% of maximum occupancy. We had a laundry list of things here that were also consistent with CDC guidelines regarding gathering together. We posted multiple sign languages, as a matter of fact, on the, on that street, and then encourage the businesses to do the same thing, but also to make sure that they are marking the space for those who are standing in lines. What I don't show you here is also the delivery zones and the pickup zones that were created, and how we made spaces for people to be able to order and then pick up without any problem as part of the outdoor dining. Finally, I'll share with you our shared streets murals, which we've had a placemaking program in the department, in the Department of Planning since 2018, and funded every year to a tune of about 250,000. The goal was to spend that on tactical urbanism ideas. And one of those ideas was really inviting arts into the public realm. And so people will apply, whether it is wrapping a signal box or doing something different with a traffic light, or do something totally different with our streets. We felt that while we were rolling this out, we wanted to make sure that with our shared streets, we combine that effort with the murals as well. It's one thing to get people out on the street, but make it attractive, make it vibrant, make it enjoyable, that it can really colors and pictures and art have a way of lifting people's spirit up. So on the next slide, you'll see what we did with regards to those murals. We decided we're going to launch 15 murals in 15 neighborhoods, each one of them 15 feet long, by 15 local artists. And we're going to restrict them to one traffic lane, especially the portion that's been, that most people will use to walk or have their wheelchair. And we're funding all of them as well. So it's really getting our artists in the process some of them who had been out of jobs because of the pandemic, we were able to employ them for a period of time and paid them to paint the murals. We also engaged the neighborhoods in terms of this is the type of mural that's been selected, for 15 neighborhoods. Which one would you like for your street? What modifications would you like to make to that? And there was a lot of support for this on various streets as well. The one that I'm really proud of that we were able to do is on the next slide, and that's a Black Lives Matter mural that we painted and installed in our urban, really the core of Uptown. Uptown is what you would call your downtown. And that is 16 letters, 17 artists. 2 artists shared a particular letter, and we paid them about $500 each to do that. And that happened over one day. It started around 9:30 a.m. in the morning, and by 6 p.m. It was done. And it's been done for about 2 weeks, and it has become a major gathering place for our African American community especially, but not just them, who typically will not come to the urban center because Charlotte is a banking city. And I personally believe that, people are the ones who make cities matter. And if people make cities matter, cities should also make people smarter, especially if those people have been marginalized. And so how could we make sure that what we're hearing right now, we respond to that? On the next slide, you will, we send that link to you, but we call it the message on the street. And so we pretty much closed that portion of our Uptown, and we're closing that for the foreseeable future and exploring how we can keep that going. I will tell you that in combination with another restaurant that's right in that block, McCormick and Schmick's, they told us that last Saturday was their most profitable Saturday since we started to reopen back in May, simply because of this message on the street. Made possible by 17 artists. So it's really activating these spaces. And remember those can-do signs I shared with you earlier? We posted all of them too along this block to make sure that while people come to spend time in this spot, they continue to maintain social distancing where possible, wearing their mask, and definitely practicing and exercising healthy habits. And we continue to keep this going. There are about 50 murals, like I said, and this one really, because it's in our main core of our urban center, has really become very, very popular. So there it is. Thank you very much for having me to speak with us today. I'll be glad to answer questions later on.
Thank you, Taiwo. So we're moving on to our second quick poll, and I am launching that right now. This is about access of through traffic on low-speed neighborhood streets in your community. So let's see. We're at 25%. It's moving quickly. 50% of you have voted. A few more seconds there, but we're close. All right, so there's clearly a trend here, and I am sharing that. And the answer is that yes, people are supportive of this kind of measure. So with that, let's move on with for Lauderdale. So Karen Warfel, I am giving you control, and you can start.
Great. Good afternoon, everyone. I'm Karen Warfel. As Fabian had said, I am the city's transportation planning manager. Today, I'm going to share with you the experience that Fort Lauderdale has gone through over the last several months. And with me, I have Kristen Thompson, who is in my office, as well as Mark Plass from FDOT District 4. And Fabian, it's not working.
Okay. I'll
Okay.
help you out.
Okay, great. So from the Fort Lauderdale perspective, we received input from a variety of different angles, from residents and staff wanting to do something to make improvements, as well as commission and business owners. Go ahead. And one of the key elements in our transition plan and our reopening was the mayor formed a working group to think about what the issues are, what we need to address, and be prepared for that phase 1 in Florida. So our group included a wide variety of different stakeholders, from residents and hospitals, hospitality, recreation, to be able to sit around the table and really understand what the challenges were for each sector. The two items that we're going to talk about today from that plan focus on the open streets, in which specifically Las Olas and A1A were identified through that plan, and as well as parking and some of the things that our parking department addressed during the different phases of opening. Go ahead. So the two things we focused on addressing were providing improved recreational opportunities, providing that more space, as well as supporting restaurants specifically that would now have that restricted indoor capability, and how could we support those businesses that have been struggling for several months already. And the areas we really that we'll focus on today are A1A, State Road A1A is pictured here, Las Olas Boulevard, as well as North Beach restaurants and shops. But then we also did do some work on Commercial Boulevard that was in a little different structure than the ones we'll talk about. Go ahead. So as an overview, with the State Route A1A lane closure, some of the key elements were that it really just focused on when the beach was closed and providing that space for safe social distancing. During the period that we did this lane closure, kind of the barrier island was pretty much closed except for residents and recreation. The main parking lots, the parking garages were all closed. And to get to where we got, it took quite a bit of coordination, different internal city departments and external stakeholders, and needing to balance all of those different needs and challenges. We needed to get there in order to move forward, and as well as funding availability. I will hand it over to Kristen to get into more detail about the process, but for funding, it was an important category to think about. And what we ended up doing was, the beach in Fort Lauderdale has a significant number of events, and especially during this time period, Memorial Day, 4th of July, a few other Tortuga, different things that would have been happening were all canceled. So the city has a fund to manage the maintenance of traffic during those large events. So we're able to tap into that funding to use it for this purpose, but it wasn't unlimited. So we had to think what would be feasible. Go ahead. So now I'm going to hand it over to Kristen Thompson, who will talk more about the details of what happened for this A1A closure in Fort Lauderdale.
Thank you, Karen. Good afternoon, everyone. So I'm going to just discuss the setup for the maintenance of traffic. It initially started with the plan for A1A to be just a pilot for a weekend to get a feel for how we were going to operate in the weeks to come. So we explored alternatives. We had to meet several times with our police, fire, our parking services department, and then also the maintenance of traffic contractor that we use, because we don't have that equipment on hand. So just the coordination, the mapping of the MOT setup, the concerns and the safety for all of the users, and the congestion for the vehicular traffic, all these things that we were trying to weigh the pros and cons when we decided what we were going to do. They weren't just, within our transportation department, they included everyone. Go to the next slide. So some of the concerns, like I said, it was coordination between police, fire, and then also PIO, which is our strategic communications. We made sure that we kept the neighbors informed as best as possible. But for the pilot, we ran into challenges after the fact because of, everyone wasn't aware of what was going on. So then our partner coordination was with Broward County and then and also with FDOT. Now I'll pass it over to Mark Plass for additional insight from FDOT.
So this is Mark. Can you guys hear me okay?
Yes.
Okay. So the reason I'm here, well, one of the reasons I'm here is that State Road A1A is implied on the state highway system. And so, any modifications to its operation would need to be at a minimum coordinated with the department, which was certainly the case here. And so I think this has been a very successful deployment. And what I found most interesting from a DOT perspective in watching these presentations today is the sense that the period of time that we've been going through, to me, is more of an opportunity to identify potential long-term, maybe permanent strategies and philosophies for how we look at urban design and mobility in urban areas. And I've seen, and this is true in all the presentations, I think there really has been a very holistic effort made to better create a sense of place in areas that maybe didn't really have as much of one as they do now. And it's kind of ironic to me that it took something like this to get a sense of place created perhaps to a higher level. So, when I think about this from the department's perspective, and I look at A1A and Fort Lauderdale as an example of this, where, we've had a philosophy for many years, and this is probably true with most DOTs, that our job was to move large volumes of traffic from point A to point B as fast as possible. And when we said traffic, we meant cars. And, pretty obviously, we have and we need to continue to change that philosophy, and it isn't simply a template that we apply on all roadways. A1A is an example of this. The Department of Transportation has spent quite a bit of time and thought in coming up with what we call context classifications that basically are templates that we can use when we're doing projects to take a look at where the project is, the context in which it's in, and then that in turn can dictate things like the physical design of the roadway, and ultimately, I think things like traffic control. And so A1A here is a really good example, I think, of a location that in a laboratory setting, if you will, has successfully reinvented itself and it has been able to move the traffic pretty effectively, during both peak and off-peak periods, weekday and weekend periods. And so I think that as we move forward, one of the things that may well be considered is, as we think in terms of context classification, maybe we have a classification that really speaks more to what you're looking at here, which is, a potential permanent or a more robust conversion of an existing roadway into something that serves pedestrians and bicyclists at a higher level of service. And I think along with that, and this is certainly true here with A1A, and I suspect it's true with the other initiatives that have been presented today, is that there also is a traffic control perspective on this. And so in the case of A1A, it's Broward County. They're the single maintaining agency. They work closely with the city and the department to assess and implement traffic control to roadways like A1A. And I think that as we go forward and we start thinking about what could we do permanently here, it's not just simply the physical design of the roadway, but it's also really taking a fresh look at how do we control traffic on a road like A1A. Would we look at things, for example, like dynamic speed limits that might be triggered by pedestrian density? So we're able to enhance the safety of pedestrians when there's large volumes of them. Are there ways that we're able to monitor in real time pedestrian and vehicular activity on a road like A1A and make real time changes to traffic control? So I think it goes beyond just the roadway, also to traffic control. And I think that working together like this and thinking longer term, you really do have an opportunity to, as I noted earlier, create a greater sense of place and thereby adding value to areas like the areas that we've looked at, during this webinar. So to me, I think it's important to look at this in terms of how does this change the state of practice moving forward. So thank you for the opportunity to make some comments.
Great, thank you very much, Mark. So if Fabian, can you just go back one slide? I mean, I think some of the key things with the experience, that's good. Key things with experience on A1A is, the traffic, seeing how it goes, working together with the different agencies and partnering. And we did a variety of kind of the heavier barriers in the cone, so it could be taken off and put in as we needed to. Okay, you can go ahead. The next. And with the FDOT, we had to do the revocable license and things like that. But what made them more comfortable, we already had police presence on the beach because the beach was closed. So we had that extra support, making sure the MOT was up and safe. We did experience one of the challenges was we had torrential rains one night or one afternoon after this was put in, and it washed away. So being active and out there during the MOT was important. So next we'll transition into some of the activities we did for business support. It's fine, Fabio. We really focused on 2 locations we'll talk about today with Las Olas Boulevard to support the restaurants on Las Olas, as well as the Galt or North Beach shops. They each were a little bit different depending on their own context. But then, and I show here, one of the things we've talked about is leveraging existing. There were previous things we've done in the city, and we had done open streets on Las Olas, and Las Olas is closed quite a few times throughout the year. So the closure and the familiarity was already there. The understanding of how the MOT would work was already there. So it helped to move things along. Then it was the same with A1A. And similar to the other cities that presented, we also, I believe Charlotte, did some parking support for restaurants pre-phase 1 opening when it was just takeout. So there were signs set up, free parking for pickup, and to allow people to understand that a little bit better and hold those spots. So again, I'll pass it over to Kristen to talk a little bit about what the process we went through for Las Olas.
Thank you, Karen. So for Las Olas, it was a little bit more of an effort to be creative. We had a lot of different alternatives that were explored because of the concern of vehicles and folks sitting in the streets, what we were going to do for emergency routes. We considered closing the roads entirely, similar to what Tampa did, but that just wasn't feasible. So we started off with a template again. We chose parking lane closures, and what we did, we extended them throughout Southeast 6th Avenue to Southeast 11th Avenue. We started with, and we have continued for it to be every weekend. We don't have an end date right now. Right now it's resting on, I guess, what will happen with the pandemic and the results of how our testing improves. But right now we have no plans of closing it. Depending on the events going on the weekends, we have been making adjustments. And so that is generally for safety concerns. With regard to 33rd Street, it's a similar setup, but it's a full closure, and this is more open. It's every evening, and it started around 4:30 in the afternoon and will be closed, picked back up. And then also what we did for the process, there was like an application for the businesses to have this access so they can have the seating outside, and then that indemnification process. These are our flyers for the media approach to share with our neighbors. The commission meetings, we have message board signs out, and then also website and social media presence for the outreach.
So just to close and wrap things up quickly, in Fort Lauderdale, we saw a huge increase in walkers and bikers. The picture, the third in, shows a restaurant where the number of bicycles, and we saw that everywhere. So we were able to allow people that space to feel more comfortable and get a chance to maybe rediscover their bike again after they hadn't for a while. So as Mark said, how do we continue that and make these things more permanent and really leverage them as transportation professionals to get support for more improvements, since now people really understand what the challenges are on our streets. So I guess I'll end there.
Thank you, Karen. And so we'll quickly move to the last couple of quick polls. So I will launch this one that it's related to coordination, interagency coordination. So let's get your responses on this one. We are at 30-something%. We want to be respectful of everybody's time. We want to still, and we're open to do our Q&A session. We have 10 minutes for that, but we will go a few minutes over. So if those of you who do not have an issue with that, we're welcome to stay and have that discussion. All right, we're almost at 60-something%, and I will close it in a couple of seconds and we can see overall responses. Yep, all right, so we will share that. So people seems to be very supportive of both neighborhood and arterial corridors. And with that, let's move also to our final quick poll, which I will launch. And this is related to overall temporary measures that you think your community can support through the next phases. Okay, responses are coming in. We're at 40-something%, so I'll give a few more seconds and we can move on to our Q&A session. Again, if folks have questions, there's the window, and we will be taking a peek at that to get back with questions to our panel. All right, so we're at almost 70%. I will share the responses, and there's almost a match there, or two high trending responses. So that's great. This is great that we were able to include and have you guys participating this way through the discussion. So in terms of the questions, we will ask that Taiwo, Danny, and Karen, Mark, and Kristen turn on their mics. We want to start with a question from Adham Naim, who talks about basically prioritizing projects based on what we've experienced in these last months, and is any data being gathered that through the experience in these last months could influence any policy or projects in the near future. So it's kind of thinking about what's coming next and what we're doing with what we're learning now.
So maybe I can start quickly and say that we are taking two approaches to all of these things, and that is the short-term approach and also the long-term approach. For example, on our mural on Tryon Street uptown, we are shutting it down for the next several weeks, and then we will continue to evaluate. However, regardless of the pandemic and regardless of the mural, there was already conversation to shut down that segment of our uptown for some time, and it's being reflected in a plan that we're working on right now. So we are looking at that both from a short-term end to achieve some of our goals right now, but there's a policy in place already that we want to create a more pedestrian and bicycle friendly uptown going into the future. So we're definitely there in terms of how long, we're going to shut it down for, and then what happens after that. We do have answers. With regards to our placemaking program itself, that's a long-term program, and I started in 2018. It's funded through the next 10 years, every year at $250,000, and we continue to ask for more. With regards to shared street, we are evaluating and gathering data, and we are hearing right now from the community that they would like to actually keep those streets closed for the foreseeable future as well. But we still need to walk through what that looks like long term.
Great, thanks, Taiwo. There's another question here from David Orchevsky, and it's basically wanting to understand, and maybe this could be for Danny in Tampa, but physical distancing recommendations will stay in place for a little longer. And has there been any thought in leveraging the use of the public right-of-way to help fund municipal budgetary shortfalls in some way?
I'm not sure I understand the question. Will
Can the use of the public space be monetized? Basically, can the use of the right-of-way be monetized to make up for some of the shortfalls in budgets that may be experienced after the health crisis?
Sure. Certainly we are facing some budget cutbacks at the city of Tampa, but also I think our local restaurants and businesses have also been hit economically. And so I don't think that we are looking to monetize use of the city right-of-way. I think we're just trying to best leverage it as a resource for not only people for recreational purposes, but for expanding business footprints to lift up our local economy. So I think that our viewpoint is, as our local economy gets stronger, so will our city budget.
Mm-hmm. Great. And maybe this one for Lauderdale team. Given the experimentation that has happened, any thoughts in long-term projects that what has been learned or done through these months? It's going to be reflected maybe in some context-sensitive projects.
I think, as I mentioned, these are areas that we already do significant closures, but I'm hopeful with A1A. We did get a lot of feedback when we were doing the closures in A1A that there might be opportunities to do something more long-term. Back in the day of open streets, when I think 2014 to 2017, when we were actively doing open streets each year, we did start the conversations with DOT to do one on A1A. It really lends itself to that partial closure. So I think we'll be exploring other opportunities.
Awesome. There's also a question from Fern Goodhart related to engagement or notifying residents. And so in terms of the outreach that has done, and any of you can feel free to jump in, but in terms of the outreach that was done prior or during the implementation to encourage either bike groups or other folks to know that those areas were going to be expanded for greater areas for bike and ped activity. Any thoughts on that?
I can share. This is Karen from Fort Lauderdale. We were very particular about our messaging because we didn't want to encourage that type of behavior. We were concerned about attracting large crowds of people that would defeat the whole purpose of what we were doing. So our messaging was much more, it's a traffic advisory, be aware, go somewhere else if you need to move quickly, and opening up to people who could walk or bike to those locations.
Mm-hmm. In Charlotte, any specific methods used for engagement and outreach?
Yeah,
Especially with the shared streets and input that was provided.
Of course, if anything has been challenging during this pandemic, it has been not been able to engage people face to face. And so you got to go the extra mile now. And so one of the things that we did was not only engage people virtually, we also actually started to make phone calls to bicycle advocates or community leaders and just asking them also to give us calls. We went in the newspaper for those who don't have social media access, and just to make sure that when you talk about shared street, equity is very important as part of that. Streets that do not have sidewalks, streets where you can't even easily ride your bicycle. How do you want to make sure that? So we engage our advocates, but we also wanted them to know that there were certain places such as Uptown where we wanted to just keep it strictly for pedestrians. And because once you start mixing that up, then you create potential for safety hazards, and you also create overcrowding unnecessarily. And so we've been working with them in lockstep, but we also want to make sure that we're not only reaching out to the folks who are the usual suspects, but those who will otherwise not speak out. So we've kind of been battling that whole engagement thing back and forth for a while now.
Great, thank you. And we'll hit the last question here, and this one's for Danny in Tampa, and it's related to data. And does Tampa have data on the retail sales for the Open Streets program? I guess a lot of folks are interested in data and how, is there any type of reporting that would benefit the cause later on?
We intentionally did not do any kind of formal reporting or data collection, just because a lot of our city staff members, I think, are pretty taxed with monitoring the program and with some other very reactive things we've been doing lately. We have heard a lot of stories anecdotally, and so we've been sharing those readily about where this works and where it hasn't and why it hasn't. Our downtown partnership in downtown Tampa did do some surveys, and they collected information about how the downtown businesses felt the full closure in downtown was working. But other than that, we haven't done any kind of formal surveying or data collection.
Okay, great. So with that, sorry, Stephanie, I think thank you everyone who stayed through. We're 5 minutes over, but thank you so much for joining, and I'll just pass it along to Stephanie for the farewell.
Thank you so much, everyone. We will follow up with an email, and of course, you can always find this information in our website, browardmpo.org or betterstreetsbetterbroward.org, and you can always access, or follow us in our different social media accounts, Speak Up Broward. So don't worry, you will get this information in your email, so you can read it, and you can also share the presentation with your different colleagues. So just stay tuned. Thank you so much. Bye-bye.
Bye, everyone.
Thank you.